Let's talk about periodic limb movement disorder. So there's a distinction to be made between periodic limb movements of sleep and periodic limb movement disorder. So periodic limb disorder is a disorder of excessive periodic limb movements of sleep that disturb sleep. The disturbing sleep part is very important because that's what characterizes it as a disorder. Otherwise, periodic limb movements of sleep can be normal and seen in older adults. So the definition of periodic limb movements of sleep are that there are 4 or more limb movements lasting between a 5 to 90 second interval. And these periodic limb movements of sleep can be seen in association with the restless leg syndrome, narcolepsy, obstructive sleep apnea, and Parkinson. And most commonly, the periodic limb movements of sleep are seen in N2 sleep, also in N1 sleep, and they are often accompanied by K complexes. In order to diagnose periodic limb movement disorder, you'll need a clinical history of sleep disturbance or daytime fatigue, and it does require a polysomnogram, which will show repetitive limb movements that are between half a second to 10 seconds in duration and separated over an interval of 5 to 90 seconds. And these intervals will occur at least 15 times in adults per hour and at least 5 times per hour in children. The limb movements will need an amplitude of 8 or more millivolts above the resting EMG, and it's usually in a sequence of 4 or more movements. So the disease also has to be not better explained by a medication side effect or substance use or other medical conditions or sleep disorders. This is a diagnosis of exclusion. So for treatment, isolated periodic limb movements of sleep don't need treatment. These can be normally seen in older people. But periodic limb movement disorder does need treatment because it disturbs sleep. So you'll want to treat the comorbidities such as restless leg syndrome first, and you'll want to focus treatment on treating the comorbidities. However, if you have just isolated periodic limb movement disorder, you can treat it with similar medications to restless leg syndrome, such as dopamine agonists like pramipexole, ropinirole, or rotigotine. Alternatively, you can use alpha-2 delta calcium channel ligands such as gabapentin and pregabalin.